Hello everybody, today we are with this hip bone. Hip bone is a large irregular bone made up of three parts: the ilium, pubis and ischium. We can say the superiorly convex ilium, anterior-inferiorly thin pubis and the posterior-inferior thick and massive ischium. These three parts are attached with each other in acetabulum. This is the acetabulum, and below the acetabulum there is the foramen known as the obturator foramen. We will discuss the ilium, pubis and ischium one by one. So coming on the ilium, ilium is the convex wing shaped. First of all, the side determination of this hip bone is that from which side this hip bone belongs. So this acetabulum should face laterally for the side determination. So keeping in your hand, this acetabulum should face laterally. So this is the left hip bone. Now ilium. Ilium is the wing-shaped, convex, expanded part made up of three borders and three surfaces. Three borders includes anterior border, posterior border and medial border. Three surfaces includes gluteal surface. This is the convex from anterior and concave from posterior, iliac fossa and sacropelvic surface. Gluteal surface, iliac fossa and sacropelvic surface. This gluteal surface, coming on the gluteal surface, is divided into four areas by three gluteal lines. Anterior gluteal line, this one is the posterior gluteal line and this one is the inferior gluteal line. And coming on to the iliac fossa is the large concave shaped and the sacropelvic surface. This one is the medial border which divides gluteal iliac fossa and the sacropelvic surface, or we can say the medial border divides the true pelvis and the false pelvis. So this sacropelvic surface is made up of three parts: iliac tuberosity, auricular surface and pelvic surface. This was your ilium. Has upper crest known as iliac crest, has three lip. One is the outer lip, inner lip and intermediate lip. These all surfaces and borders have distinct function which will be described in the next video. So coming to the anterior inferior pubis. This is the anterior inferior pubis, forms anterior surface of obturator foramen. So this pubis include pubic tubercle and symphysis surface and different parts. It is flattened before, backward and superior border known as the pubic crest, pubic tubercle and lateral end of the pubic crest. So the pubic tubercle is lateral, forms anterior surface of the pubis directed downward and slightly lateral. So the superior and the posterior are pelvic surface. This one is the anterior surface, this one is the posterior, this is the posterior surface. Anterior surface, posterior surface or pelvic surface is the smooth and upward and concave. Medially, this is the symphysis surface which articulates with the another hip bone, forming pubic symphysis or junction between two hip bone. So this pubis has two ramus. One is the superior ramus and other is the inferior ramus. This one is the superior ramus and the inferior ramus. The superior ramus extend from the body of pubis on the acetabulum, and obturator foramen. The superior border is known as pectineal line. This one is the pectineal line. Our pectine pubis is the sharp crest extended just behind the pubic tubercle and the posterior part of the pubis. So the anterior border of the obturator crest form the round ridge, and the inferior border is the anterior border and the inferior border forms sharp sharp and crest. So the pelvic surface, this pelvic surface lies between superior and inferior border, smooth continuous with the pelvis. So the obturator surface lying between anterior and inferior is known as obturator groove. This one is the obturator groove. And inferior ramus extend from the body of pubis and attaches the ischium with the help of conjoint ischiopubic rami, or forms lower margin of the obturator foramen. Now coming on the ischium, ischium forms posterior inferior thick part. It forms 2/5 of acetabulum, and posterior boundary obturator foramen. It has two ends, one is the upper end and other is the lower end, or we can say it has the ischial tuberosity and different three surfaces. Body of ischium is the thick and massive, lies below behind the acetabulum, and in the lower it has three border. It has the anterior border, it has the posterior border, and it has the lateral border. Keeping in the anatomical position, it has anterior border, posterior border, and lateral border. So, and it has three surfaces: the femoral surface, the pelvic surface, and the dorsal surface, which gives different attachment to the different muscles. Posterior inferior 2/5 the acetabulum, ischium attached with the acetabulum. So the lower end forms ischial tuberosity, and it has the ischial ramus, which attach with the ramus of inferior ramus of pubis to form conjoint ischiopubic rami. This posterior border is the continuous above with the posterior border of ilium, continuous above with the posterior border of ilium, and lateral border forms the margin of ischial tuberosity, and the upper end femoral surface lies between anterior and lateral border. So the conjoint ischiopubic rami gives junction between inferior ramus of pubis and ramus of ischium, which unites with between these two ramus, and the medially side it has the two ends, upper end and lower end. It is medial and lateral. Upper end forms the lower margin of obturator foramen, and lower end forms pubic arch. So this was your hip bone, and in the next video we will describe about the muscle attachment.